everybody, my name is Penny Zoll, and I'm one of the nursing instructors here at NTC. You've probably heard that something really important is happening in your nursing program this September. Well, the following presentation will explain exactly what's happening and what you need to know.
So some of the questions you may have are what's happening in September and what do you as a student have to know and how will it affect you? Well, we are going to have a reaccreditation site visit during the week of September 22nd. But first, let's take a time out for a brief history. NTC's nursing program was first accredited in the year 1992. Then it achieved reaccreditation in both 1997 and 2006. In 2006, the program achieved the longest accreditation possible, which was 8 years. So now that it is 2014, we are once again due for reaccreditation, and that's why our site visitors are coming in September. So who exactly is visiting? Well, that would be ACEN. ACEN is an acronym that stands for the Accreditation Commission for Education in Nursing. ACEN's purpose is to provide specialized accreditation for nursing programs. ACEN is recognized for excellence by the United States Department of Education and the Council for Higher Education Accreditation. So you may be wondering why accreditation is important for our program and for you as a learner. Well, reaccreditation shows that you are attending or have graduated from a program that is recognized as having excellent rigor and quality. It also provides official recognition that your nursing program meets the standards of accreditation, which means that it has met or surpassed the benchmarks of educational standards. It is recognized that graduates of ACEN accredited programs outperform other graduates on licensure and advanced certification examinations. Your transition to a BSN or graduate program may be affected by the accreditation status of your program, making reaccreditation even more important. And keep in mind, there are some scholarships that are available only to students who attend ACEN accredited nursing programs. So what are some key items that a nursing student at NTC needs to know? Well, first off, is that NTC is part of the WTCS, which is the Wisconsin Technical College System. I'm wondering, did you know the following facts? There are 16 colleges in the WTCS, of which NTC is one, of course. All 16 of these colleges have a nursing program. And all of the 16 nursing programs have the same curriculum, which allows for seamless transfers. And finally, that all 16 colleges have the same program student learning outcomes, also called the WTCS program outcomes. So what are these WTCS program outcomes? Well, they are the same as our program student learning outcomes, or SLOs for short. Now you've seen these outcomes on your syllabi and in the Nursing Student Handbook. Do you recall what they are? Well, here are the first 3 of 7. The first one is regarding implementing one's role as a nurse. The second one addresses communication. The third one is regarding integrating social, mathematical, physical sciences, pharmacology, and pathophysiology in clinical decision making. And here are the last 4. The fourth one is regarding providing patient-centered care. The 5th one is minimizing risk of harm to patients. The 6th one is regarding leading the multidisciplinary team. And finally, the 7th is using information and technology. Okay, so let's talk briefly about your theory and skills courses. Every theory and skills course in the nursing program has course competencies, which are course student learning outcomes. These competencies are learning outcomes that help you develop knowledge and skills to progress towards graduation. Your course competencies link to the 7 program outcomes that we just reviewed. And again, you will see the 7 program outcomes listed in each syllabus. As you know, to help you meet the course competencies, each learning plan has readings, class activities, projects, exams, etc. Okay, so let's talk just a bit about your clinical courses. In each of your clinical experiences, you are giving verbal and written feedback based upon how you are progressing towards meeting the 7 program outcomes. Now, to help you practice and review, the HLRL and tutors can assist you. Now, remember that they do not teach you or test or evaluate you on skills or in the simulation setting. They just can help you review or practice information that you have learned in class. The faculty provides the HLRL and tutors with materials and directions in order to assist you. All right, so we're in the home stretch now. There are only 3 more things we'd like to review, and those are items from your nursing student handbook. And they include the mission and philosophy statements, the conceptual model, and the grievance policy. If you turn to page 7 in your nursing student handbook, you will see the NTC mission statement. And this is the same statement that all 16 colleges in the WTCS system have. And you can see it is that we are committed to educational excellence. We prepare nurses with the knowledge, skills, and attitudes to enhance and restore well-being of individuals, families, and the community by using the nursing process. Underneath the mission statement, you will see this philosophy. Now, I'm not going to go through the whole philosophy now, but I'd like you to know that it reflects the nursing faculty beliefs of what nursing education is. And in that philosophy, when you review it, you'll see that we have defined nursing, individuals, families, and groups, as well as nursing education. So take a moment and become familiar with our philosophy. Next, we're going to look at our conceptual model. This is on page 9 in the handbook. This model is derived from that mission and philosophy that we just looked at. It is a visualization of the dynamic interrelationships of many concepts. So let's take a closer look at it. Here we have your conceptual model. And as you can see, the student, or yourself, is right in the middle. Stemming from that is kind of a compass type of a model. You'll see there are 2 stars in the middle that intersect with students, and those are some of the main concepts related to the nursing program itself, the consumers, and resources available. So you'll see terms such as PN, ADN, consumers, resources, etc. Now, surrounding those stars and the student at the hub, you will see 3 circles. The inner circle has the key concepts of the nursing program, and these are in fact taken right from the mission statement that we just looked at. So terms such as critical thinking, caring, nursing process surround the compass. The middle circle are what we call threads. And these are concepts that thread through the entire curriculum, such as diversity, lifelong learning, holistic, patient-centered care. Encircling all of it are community, individuals, family, and society. And these are the environments that you as a learner practice and grow in your knowledge and skills. So please take a look at the conceptual model on page 9. We've been told our visitors may ask you about it, and we hope that you'll be well informed. Lastly, we're going to take a peek at the grievance policy. Now, a grievance or complaint is a formal expression against a party or program that's usually expressed in a written and signed format. So to clarify this a bit, a diagram has been developed, and it's on Appendix 6 on page 52 of your handbook. The types of grievances are listed in this column of circles. Beneath the specific grievance, there's an area that tells you as a learner where to find out more about those policies. For instance, if a learner would have a grievance about math policy, they could read about it in the handbook, and the level 1 appeal would be with the faculty member. That's always the first place to go, student with faculty. At that point, if it's unresolved, it becomes formal in a written grievance, and then in this case it would go to our program director, which is Luann Theis. If it remains unresolved, it would go to our Dean of Help, who is Lorraine Zaromsky, and so forth. Another example, let's say there's an academic appeal. Perhaps a student is appealing a grade or an evaluation. They can read about it on the NTC website. And the first level of appeal, the first level in the chain of command is always student with faculty. So that conversation will be had, and hopefully the grievance will be resolved. If not, this diagram will show you exactly where the subsequent appeals should go. I hope this helps clarify this process, and we also have been told that you may be asked questions about this from our ACEN site visitors. So I hope this presentation was helpful. If you have any questions, please feel free to contact faculty about it. We look forward to having a great semester with you, and also look forward to having successful reaccreditation together. Have a great day.